Hello everyone, thank you for joining me this afternoon. I'm Sisi, studying health informatics from Karolinska Institute. My topic is about prioritization of actions needed to develop the IT skills of healthcare workforce. The presentation will start with introductions, followed by aims, research questions, methods, results, some discussions, and end with conclusions. As we all know that healthcare systems throughout the world are facing critical challenges that result from aging populations, prevalence of chronic conditions, and rising life expectancy. To cope with these challenges, a large part of public expenditure is spent on health, which shares almost 9% of GDP in Europe. Meanwhile, there are different ongoing reforms change the structure of healthcare delivery, for instance, the mobility of health professionals and patients, and the shifting from inpatient care to outpatient care. With the promise of efficient and effective healthcare, e-health has the potential to address these challenges. However, the adoption of new technology must be accompanied by a workforce able to undertake its professional duties. From this figure, we can see that there is a great skilled workforce shortage in certain health professions to cover the care needed. So what about the current state of IT skills? According to a European project which analyzed the results of health professionals and patients' experience in e-health, the issue of confidence and skills was very much presented. In that project, only 20% of health professions reported that their management team promotes the use of e-health. Traditional curriculum does not always equip the workforce with required knowledge and skills to make optimal use of e-health. Some studies also showed that there is a fundamental lacking of understanding of basic IT skills in undergraduate students, as well as limited informatics exposure. From this, we can see that identifying an approach for achieving a supply of highly professional health workforce is needed to use e-health efficiently. The e-health IT skills in this study refers to the ability to carry out technical tasks in the e-health field, while the healthcare workforce refers to people whose primary intent is to enhance health. So the aim of this study is to identify the actions needed to provide IT skills of healthcare workforce and identify the priorities of these actions with collaboration with healthcare experts. Through this study, we would like to know what actions are needed in order to develop the IT skills and what are the healthcare experts' opinions regarding these actions in terms of prioritization. The methodology used for prioritizing was developed by Child Health Nutrition Research Initiative. It has 4 stages. The first one is define the context, specify criteria, get expert input, and compute the priority scores. In this study, the main settings are based on Europeans. The target population is healthcare workforce, while the problem is deficiency in IT skills. According to the CHNRI framework, 4 criteria were selected, including effectiveness, feasibility, deliverability, and maximal impact for competence improvement. We have invited a group of experts with diverse backgrounds to list the actions and score the actions based on the selected criteria. The selection of actions was based either on they have a good track of record on research or they have a membership in international health organizations, for instance, International Medical Informatics Association, Computer-Based Medical Systems, European Federal of Nurse Associations, HL7, and OpenAir. So, a wide range of experts participate in the listing and scoring process, including health informatics, e-health, standardization, education and e-learning, and people with clinical background. In the listing process, there are 29 experts from 14 countries participate in the study, including UK, US, Finland, Switzerland, Denmark, Germany, Spain, Norway, Czech Republic, Ireland, Australia, Iceland, Belgium, and Netherlands. And 34 experts from 19 countries participate in the scoring process. Here we include the experts from the US because the close cooperation between EU and US, also because both the EU and US are actively addressing the needs for skilled workforce. To compute the priority scores, all the answers will be assigned a score. For instance, yes will be assigned 1 point, no 0 point, undecided half point, not qualified to answer will not be counted. Then the overall priority score was computed as the mean of scores for 4 criteria. In total, there are 23 actions scored by the expert. The action that achieved highest score is related to integrate health IT in curricula at different levels. The action was rated as highly feasible and effective. The likelihood of deliverable and maximal impact were also relatively high. The actions focused on training also obtained high scores, including train the trainers and training on patient-centered e-health. In addition, raise awareness of importance of e-health and inclusion of healthcare professionals in the development of e-health were also recognized as important to improve the IT skills. The actions ranked from 6 to 10 were also related to continued training, increase users' confidence in e-health, and improving learning arrangements, for instance, facilities, methods, and equipment. The result revealed that from the perspective of healthcare experts, the most feasible and effective action is to integrate health IT in curricula. The most delivery action is to raise awareness of the importance of e-health, while the action that has maximal impact is to train the trainers. The results are generally in line with other recommendations, for instance, a EU report on e-skills and healthcare workforce. In this study, the low scores in deliverability criteria illustrate the fundamental characteristics of health system delivery across Europe. The strength of this study is the clear defined context and criteria, which qualify some actions as a funding priority over the others. The methodology also provides a transparent and systematic process for individual input, which minimizes the individual bias on the outcome. The results also provide a simple quantitative outcome, which is easy to justify and understand. Of course, the study is not free of some barriers. The first one is the selection of limited experts. So some good ideas may not included in the initial list. As you can see, the expert group is not balanced. Although the efforts was made to try to include a wide range of expertise, not every country in European and healthcare fields are included in this study. Besides, the experts' understanding on the concepts may also affect the result to some extent. Since the scoring process is transparent, so the information about the amount agreement about experts may obtained. Since the study context and component may change over time, the future study could add more actions, criteria, scoring the actions in the redefined context. Overall, the findings are a clear call for the integration of e-health in curricula, continue training for trainers and workers, raise awareness of importance of e-health, and inclusion of health workforce in health development. This is my presentation. Thank you.
Did you want to ask a... No? I'd like to ask a question. I think it's a really interesting study.
Yeah.
How effective do you think it is to be able to integrate e-health into the curricula? Have you come up with some ideas of what should be included to try and get some comparability across the whole of Europe and the States?
I have not think about this because these actions were proposed by the experts, not by myself. So maybe there could be some other future study to identify what kind of course can be included.
Any other questions from the floor? I think it's really interesting, and I think it's showing how important it is that actually everybody starts working much more together, because you can see there's a lot of synergy about what needs to change. I think the challenge for us all is how do we actually make the change? Who do we need to influence to start bringing these things on board to make sure that our health force are as skilled as we need them to be? So thank you, Sisi.
Thank you.